All right. Good afternoon. I love that song. Welcome. Welcome. I know there will be a few more people joining, so I'm going to give you all a few minutes to join and make sure that you can hear me. And if you can, please raise your hands and or give me some reaction. Okay, fantastic. That's good. I know everybody. Oh, thank you. Oh, and the thumbs ups too. Okay, awesome, awesome. All right, so I'm going to give people one more minute to get on, but you guys know I am about being timely. And so we are going to get started because we have a lot of information to get through, and I want to give you guys a chance to ask me questions at the end. Because I'd be lying if I said I wasn't nervous about this call today. I've been looking forward to it all week, but still just hoping that I find the right words today. So ask you guys to bear with me as we start to discuss the occasion. Does anybody else have feedback or an echo? If not, I'll just keep going. Okay, awesome. All right, so why are we here? Why are we here? We are having our town hall meeting because Full Circle Women's Care is changing our primary facility. For 9 years, we've been at Ascension St. Vincent Southside, and it has been awesome being there with them. And we are now changing to HCA Florida Memorial Hospital effective Monday, October 30th at 7 a.m. So, what that means to those of you who are currently in queue for some procedure that requires an inpatient stay, we will not be scheduling anything at Ascension St. Vincent's after Friday, October 27th, 2023. If you go into labor over that weekend, please call us. One, you're supposed to call us anyway. So please call us so we can direct you to the correct facility. We'll still be taking labor admissions at Ascension St. Vincent's until Monday. That's October 30th at 6:59 a.m. Now, we are going to stay and finish our deliveries. So it's not like, oh, girl, you didn't push that baby out fast enough. We just had to catch whoever can catch you. So there will be a few days that we are wrapping up our routine inpatient care at St. Vincent's before we begin admitting people on a regular basis at HCA Florida. Now, people will ask, well, what happens if I do the wrong thing and I go to the wrong place? We do still have privileges at Ascension St. Vincent, so you can still be admitted under one of the physicians. However, as that is no longer going to be our primary facility, if we are unable to, because of other obligations for patient care at our primary facility, unable to attend your delivery, we will be relying on the hospitalist group for backup coverage at Ascension St. Vincent's. So if you want a full circle birth, I would recommend going to the hospital where Full Circle will be delivering as of Monday, October 30th, 2023. Why are you doing this, Dr. Adams? Why did you wake up one day and choose violence? This is an extremely inconvenient move. Believe me, it is not easy to switch your whole practice to another hospital. We are having to credential at a new facility. We are learning new door codes to labor and delivery and call rooms and all of that stuff. The floor maps, figuring out where what room is and what the new room numbers are. I'm still learning the room numbers. Learning a new electronic medical record system. Only one of our providers is on the youngish side. We're all a bunch of middle-aged old ladies. We don't want to learn new electronic medical records, but we are doing it. And the question, why is because of this. So the slide that we have up right now references the topography of maternity care in Northeast Florida and in Jacksonville. And some of you are not aware, but in the last couple of years, two major maternity units have closed in and around Jacksonville. First was Baptist Nassau with the retirement of one of their two major physicians. And that pushed a lot of deliveries from the Fernandina and South Georgia area down into some of the hospitals that are in the northern Jacksonville region, Baptist and Riverside. And then this March, Riverside, Ascension St. Vincent's Riverside closed its maternity unit as well, which pushed a lot of the people who were still pregnant into other facilities. Now, the number of deliveries in Duval and surrounding areas has not changed over the last couple of years. It's ranged anywhere from 12 to 13,000 babies per year. And those people were still pregnant and still needed someplace to deliver. And so at this point, the remaining hospitals who still offer maternity care are reaching higher census. While the same time that this was happening, HCA Florida Memorial actually had volumes that they were delivering probably about 120 to 140 per month with the OBs who had privileges there, and they retired. 5 of the 7 active OBs retired or stopped doing obstetrics in the last 2 to 3 years as well. So then you have this facility that was doing 120 deliveries gradually decreasing to now doing about 40 to 50 deliveries per month. And all this is being done in a newly renovated facility. So they renovated this whole unit, and then all the doctors, all the patients, all the babies left. So this place, this beautiful place that I'm showing you now, these are actual pictures that were recently taken of the facility. Was essentially empty, doing 1 or 2 deliveries per day on average. And so I'm going to leave that slide up while I just address a couple of rumors, because I am used to other providers and practices in the city asking, why is Dr. Adams doing things that way? I'm not really used to the patients asking why I'm doing things the way that I'm doing them, because I'm usually doing what patients are looking for. So I want to address a couple of rumors. You know, I'm close with the doulas, and they tell me, they have their ears to the ground and tell me what people are concerned about. Just one, something about infection rates in the hospital or in the maternity unit. I'm not even actually sure what it is, because I haven't been able to see what numbers anyone's talking about, and I don't really believe that there are any numbers that anyone's saying. One of the doulas was saying they have some rates from 1980. And I mean, to be honest, if you're going to decide whether or not to deliver with our practice based on what a hospital looked like when I was 4 years old, I'm probably not going to be able to talk you out of it. But what I can tell you right now is, if you look on current Leapfrog, if you look on health grades, you will see that this is rated a top 250 in the nation hospital. That's out of 5,000 reporting hospitals, which puts HCA Florida Memorial in the top 5% of hospitals, not just for orthopedics and stroke and trauma, but for vaginal delivery, as you can see here on their wall, for C-section delivery. And those are awards that you can't get if you have issues with infections, or if you have issues really with anything. Like, these are very stringent criteria. So I encourage you to look for yourself on Leapfrog and on health grades. And I see that there is a question down in the chat, and I'm going to hold all questions until the end. So please just leave it out there, because we will address it in the end. But you can see on this slide, this is 5-star recipient. The neonatal ICU there is a level 2, which is the same as our current facility. So for moms who may need to have their baby stay in the hospital a bit longer, or who may be delivering preterm, this is a lateral move for us. So anything that happened at Ascension, St. Vincent Southside, you can expect a similar level of care to be available. In fact, the neonatology group that comes to HCA Florida is the Mednax pediatric group, which is the same group that staffs Ascension St. Vincent. So there's a lot of overlap in the actual care. So you are welcome to tour this facility. We are not hiding this. This is probably one of the best kept secrets in Jacksonville, that this newly renovated empty facility needs someone to come in and deliver babies there. But they are giving in-person tours at this time. Actually, Stacy Carter, the director of Women's Services, you can call this number and she will set up a tour with you personally. She's doing tours during the day. She's doing them after hours. She's doing them on the weekends, if you want your significant other or family to be able to come out and see the unit as well. There are questions also about where the hospital is located. Yes, there is an apartment complex that's across the street that's being torn down or something like that. And I don't know if people are concerned about that being something with the neighborhood. I don't know. It's a safe area. It's I promise I will not deliver your baby in the apartment complex across the street. It will only happen in the hospital, which is it has excellent lighting. And there is also, there is maternity parking actually right up in the front of the hospital. So when you pull up, you actually pull up to the building. And if you are, showing up in the middle of the night, you're pulling up to the building. So you're not walking across a parking lot at all and walking directly into the well-lit facility. So those are the rumors. Now I want to address the real concerns and real questions that people have had with regard to our transfer. One is about registration. Our current process at Ascension has been to give you your paperwork at around 28 weeks for you to fill out and mail back in to the hospital. We have in each exam room QR codes that you can scan in order to find the HCA portal to input your information and your demographics. Registration will now be online. So anyone who has a due date of October 15th or after, even if you've already registered at Ascension St. Vincent's, please also register at HCA, because babies don't have calendars, as I tell you all the time. And your baby doesn't know where you're supposed to deliver. So please, let's have both facilities available and ready with your information. So if you've already registered at Ascension St. Vincent's, please go ahead and register at HCA as well. And this information, again, this presentation will be available on our website too. But this is in every exam room. So when you come for your prenatal visits, you'll be able to see that too. The other real concern or questions that people have been regarding insurance coverage. So every insurance with which Full Circle is in network, HCA Florida Memorial is in network, with the exception of Blue Select. So you'll see out here your Aetnas, your United, your Cigna, your TRICARE, your Blue Cross Blue Shield, again, with the exception of Florida Blue. The ones that are not listed on here are Share Care and Ministry, like Christian Care Ministry, as well as Mayo. So again, because Mayo does not have obstetrics, other hospitals in the city are on an equal tier. So there's no difference. Again, this is a lateral move in terms of insurance acceptance, with the exception of Blue Cross Blue Shield. To that end, I know Blue Select of Blue Cross. To that end, I have petitioned on your behalf, because I'm always advocating for my mamas, for those who started care with us and were anticipating delivery at a hospital that does accept their insurance. We've had full support of the administration. They have gone above and beyond and have agreed to accept case-by-case authorizations for those who have Blue Select at the time of moving to this new facility. And in fact, I have two of the members of the administrative team on the line today. So I'd like to bring them on to say a few words. I know you may have questions for them. Please feel free to add those in at the chat too, but please hold your questions for them until the end. So I'm going to hand it over to David, and I will mute myself while you and Eleanor and Stacy say a few words.
Good afternoon. Thank you, Dr. Adams. So I do have Eleanor Lynch, our Senior VP of Operations here, and Stacy Carter, our Director of our Women's Services Unit, and a couple of other folks here to help with any insurance questions should we get them. But good afternoon. My name is David Three. I'm the Chief Nursing Officer here at HCA Florida Memorial Hospital. I've been at Memorial for a little over 2 years and with HCA for almost 11 years. A little bit about my background. I received my doctorate in nursing and master's in informatics from the Medical University of South Carolina. I'm very passionate about the care we provide here and proud of the Memorial team for the incredible work that they do each and every day. And it's an honor to be a part of Full Circle Women's Care and to be able to share some of the great things that we do here at Memorial. And I think, Dr. Adams, you said it best. We're the best kept secret in town. If you look at how we are recognized nationally, you mentioned Health Grade's top 200 hospital in the United States, which is top 5% in the country. We do a lot of work here, and we're very proud of that work that we do. So you can see here, this is our Boy Scouts honor badge, or our flare that we have for the hospital. And it's great to get a lot of these accolades. And I'll talk a little bit about the staff and really how we got here and the care that we provide. So more specifically, we're recognized as being the only hospital in Jacksonville for providing excellence in labor and delivery and OBGYN services, for having superior clinical outcomes during and after childbirth and GYN surgeries. Our NTSV rates, our NTSV C-section rates, are well below the national average, and our unexpected outcomes for newborns are top decile in Joint Commission's view of that, and well below national and local rates. Our hospital acquired conditions, I'm glad you brought that up, because a couple of things. So there's things like central line associated infections, and that's an infection you get in your bloodstream when you have a central line. And in the women's department, it's been 9 years since they've had an infection, which is eclampsia. So very incredible work that they do there. Catheter-associated urinary tract infections. So it's been over 8 years since they've had a urinary tract infection that was introduced from an indwelling catheter, and that's incredible. That's just extraordinary care that our teams provide. And a couple other things like C. diff. We've never had a C. diff in the women's department. So it's just a lot of good work that they've done there. Surgical site infections for abdominal hysterectomies. Those are, again, significantly below national averages. In order for us to get these accolades, we have to be able to prove that. And we prove it through third-party, non-biased people. So a couple of things, too, that we do in the community and just regionally. So March of Dimes, some of you might be familiar with March of Dimes and the work that they do. But we partnered with them a couple of years ago, utilizing clinical data and pioneering research to improve maternal and neonatal outcomes. In Memorial, one of the great things that our team is just very passionate about it. So Memorial won top prize in March of Dimes Coast to Coast fundraising challenge. So that's beating out more than 30 hospitals statewide. So just the incredible work. People are very passionate about the work that they do here. You know, it's great to be recognized as one of the top 5 hospitals in the country for clinical excellence, but more importantly to me and our team, it's very important what our patients say about us. So our women's department, they rank overall 94th percentile, and that's a comparison of 2,300 hospitals in the United States. And we're at the 94th percentile looking just over the last 12 months. So that's just incredible work that they do. For the nurses and physicians, they rank 96th and 99th percentile respectively. So we're just very proud of our highly skilled, compassionate teams here at Memorial. And we're looking forward to being a part of your experience here. Thanks, Dr. Adams.
Thank you so much, David. I really appreciate you taking the time out of your day to talk to our patients specifically to reassure them. All right, so Full Circle met an important milestone just a couple of months ago. We delivered our 4,000th baby. We have been around since 2014, and we started with just me and Lauren, midwife Lauren, and we've grown. And many of you have heard me say that growth scares me. With the recent addition of Dr. Mooney, who many of you will get a chance to meet as well, we have reached 10 providers. We have 10 providers now. And by many assessments, that equates to being a large practice. But it only equates to being a large practice if we continue to grow our patient base out of control. And my goal is not, it has never been for us to be the biggest practice. It's always been for us to be our best selves. I do not compare myself to other practices. I will not compare one hospital to another because we are not leaving St. Vincent's, we are joining Memorial. We focus on what the positive action is here. And I don't compare myself to other providers. I compare myself to the provider that I was yesterday. And my goal is to always get better. And you don't get better necessarily by getting bigger. I can't be my best self if we're trying to deliver every baby in Northeast Florida and South Georgia, but we can do it by creating boutique experiences in intimate settings. Florida HCA Hospital didn't renovate in order to capture more business, in order to become the biggest, most churning out all the babies in Jacksonville. They renovated to be able to better serve the moms who are looking for what they are offering. And that philosophy is in line with the direction in which I want to take Full Circle growth. Many of you, we've grown completely by word of mouth. I don't do any advertising. We haven't done any advertising. This is probably the most thing that feels like advertising to us since we started. And when some of you have referred your family or referred your friends and they call and we say, I'm sorry, we're full for that month, we're met with shock. You have all those providers there. How are you full for that month? Because I don't like a ratio of greater than 1 provider to 5 patients who we're delivering for that month. And when we had these same numbers at Ascension St. Vincent's before the closure of the other hospitals, we were probably doing about 35% of their deliveries. So, we're a medium to large practice in a moderate size pool. But in a higher volume facility, we dropped to doing maybe 18 to 19% of their deliveries per month. And we have enjoyed the ability to influence birth culture in a moderate volume facility. This is one of my favorite pictures. Credit to Dallas Arthur. She's just a fantastic birth photographer in our community. But this is a picture of a gentle cesarean, and Full Circle did our first gentle cesarean, which is a term that we kind of coined our model, our method of gentle cesarean here in Jacksonville. We did our first one in 2019. And everyone was surprised and bewildered. And why would you turn the lights off? And why do you need clear drapes? And why do you need to delay cord clamping in the OR? It's a surgery. There's no birth to support. Why do you need to get doulas in the operating room with the patients? Because it's birth. And again, being able to do that at a place where we were 1 in 3 of the births, it was easy to influence the culture. At Florida HCA, with our numbers and their numbers, 1 in every 2 births at that facility at this point will be by Full Circle Women's Care. So the culture, the birth culture that we bring will become the standard, and it will become ingrained and integrated in how the staff interacts with the patients. The providers who retired were great providers with a different view of how maternity care should be delivered. And the culture of the hospital goes along with the providers and how they think the birth should most safely be carried out. The nurses are there to facilitate getting the birth carried out the way the provider thinks it should safely be done. When Full Circle comes in and says, yes, but this is a full circle birth. We want the rebozo. We want the cub to position. We want the squat bar. We want the diffuser in the room. We want tubs. I know y'all have heard there are tubs, and there are tubs, and they are there. And we've been blowing them up and filling them up. And we are so excited to put y'all in those tubs. But it's not my intent to try to lure you to a facility with gimmicks. It is my desire to continue to be the authentic person that I've always been and provide authentic maternity care. Some people are going to transfer out. Some people will listen to the experiences of patients who delivered with other providers at this facility. And when they say, had a bad experience there, but you weren't with Full Circle. Some will believe rumors about phantom infection rates, even though there's lots of evidence to the contrary. You weren't with Full Circle. Some will prioritize proximity and geographical locations over the birth experience that we offer. I can't guarantee if you leave Full Circle. But I've always been about patient autonomy, and people are allowed to make decisions with which I do not agree. By moving my practice, though, I will select for those patients who are willing to step out of their comfort zone to ensure access to the individualized experience for which Full Circle has come to be known. It's the same thing I always tell my mamas in labor. Will it be easy? Maybe not. But will it be worth it? Absolutely. I'm going to open the floor for some questions now. All right, I am just going to start at the top and I will read them off. And then if there's something that I need to turf to you, David and Eleanor and Stacy, I will do so. I have Florida Blue Select and HCA is not a network. Perhaps you typed this before I said the other thing. Will I be able to get approved to have in-network benefits at HCA since I chose Full Circle due to them being in network with St. Vincent's? And David, I'll let you answer this one again.
Thank you, Dr. Adams. Yes, we've already have gone through the process and essentially have received approval for several Blue Select patients. And so we are able to do that, absolutely.
Awesome. Next question is, my official due date is October 29th. I have directed blood donated that is being sent to St. Vincent's. In the event I go past my due date, is it possible to have my directed blood donation moved to HCA Florida? What do I need to do to make sure the blood gets to the right hospital? I'm going to turf that to you as well.
Yep, thanks, Dr. House. Great question. So we've already, we were kind of looking at the Q&A questions as we were doing this and reached out to our laboratory director. And we're waiting to hear back on that. So we're going to have to follow up on that with you, but we'll get an answer for you.
Okay, and I have your name attendee, so I will definitely reach out for you. Next question, does the NICU have rooming in or private rooms? It does not have private rooms or rooming in. Next question, curious if the hospital offers wireless monitoring during labor. Yes, absolutely. I believe, Stacy, there are 6, 7 Novis available, but the short answer is yes, there will be enough for the number of people who are laboring and need them. Next question, for transition center birth mamas, that is something you'd have to take up with transitions. Unfortunately, I'm only able to answer questions today regarding Full Circle. Next question, to confirm, Florida Blue options is not accepted. That is not correct. Blue options is accepted. Blue Select is the concern, which will not be a concern because they will get that. How is the breastfeeding support? Oh, fantastic. We have actually also in the office information on the certified lactation consultants who are there on the floor. They round daily, just like when we were at Ascension. We have breastfeeding, we have lactation classes. Stacy, maybe I'll let you field this one about the courses that are offered there and the support groups.
Sonia Coleman is our lactation consultant, and if you go on the website, you can see the classes. You can sign up for classes, and she does outpatient postpartum support too. So after you're discharged, you can come back and meet with Sonia in some of her groups.
All right, fantastic. Yes. The next 2 questions are about Florida Blue. And yes, they do accept Florida Blue options. If we have Blue Select, what's the alternative insurance we could get? I believe everything else on the marketplace is in network. I don't think Bright Health even exists anymore, but I think that was the only other thing that was on the marketplace. You all accept Ambetter as well, correct? Okay, and then, or how do we get exception for the delivery? And you just contact our office manager, Renee Turner, and she connects with our benefits coordinator who has a direct line to the financial services there. The next comment, y'all caught my mom's cervical cancer, and we will continue to take care of you and other members of your family as well. And the next comment, as long as I'm with Full Circle, I'm good. I appreciate you, sis. The next question is, are the tubs available for trial of labor after cesarean patients? And yes, they are. So the same stipulations for moms who have not had a previous cesarean. Just we need to be able to monitor your baby continuously, which we can do with the wireless monitors as they are water resistant, and you have to be full term and in active labor. Next statement. Thank you for accepting Blue Select on case by case. Can we get something in writing? Peace of mind. So we actually are getting authorization numbers, correct? So when you go through the Renee's at my office, Renee Turner, my office manager, Renee Hall, my benefits coordinator, you will get an authorization number as well. Next, thank you for sharing my work. Yes, we appreciate you and everything that you do for the community. The next question is, how many labor and delivery rooms are there in total? There are 6 rooms currently. And as you all know, if you've been with me at Ascension, that is a smaller unit. But again, that goes to the fact that we are doing less. We are concentrating on the patients who are already in our care and just trying to deepen our relationships with them. Next question, how does Memorial plan to deal with the sudden increase in delivery staffing wise? They can stop sending nurses home because really they've had the nurses there. They just haven't had the patients. And they've also hired more nurses. And I believe so they filled days, they filled nights, and they have the PRN positions. So they advertise for people there. And I'll tell you, there's very low turnover at this hospital. I actually started at HCA Florida back when it was Memorial, just known as Memorial, in 2008. And the same nurses who were there then are still there on the floor. They love birth, they love labor and delivery, and they love working with each other. It's such a collegial environment. There's so low turnover. Next question, in the app for HCA, where do we go fill out the pre-birthing paperwork? It's a portal. There's the portal area. You have to create a portal account and then put your demographics in and answer the health history. If you're having any problems with it, just that you can also use that number that is up there for tours. Is that correct? And someone will help you, like, walk you through it. Awesome. Next question, what I liked about St. Vincent's when I gave birth a few years ago, anywhere my baby went, either I or my partner was able to follow. Will that be the same? We encourage family bonding. We are not trying to separate you from your baby. So again, this is full circle advocating for your family to stay together. And that is our goal. Absolutely. My due date is November 11th. I've heard the tentative date to move is beginning of November. Oh, you must have tuned in at the end. If you go back and watch the beginning of this, I actually give the exact date and time when we switch over. Next statement, we'd love to hear about what positive steps HCA has taken to increase support for the NICU team and their outcomes at Memorial over the last 2 years. I will turf that to you guys.
Yeah, so I'm going to have Stacy. Yeah, could you repeat the question for us, Dr. Adams?
I think the question was taken out, but it was essentially, what have you done to increase NICU support over the past couple of years?
NICU support in terms of the babies?
She wasn't really clear. If you can add another question in at the bottom, I'm sorry, because I wasn't 100% sure what you meant about increasing support. If you can be a little bit clearer, we want to answer your question thoroughly. Next question is, do they have yoga and peanut balls? They have peanut balls. I believe, do you have birth balls, or do the patients need to bring their own birth balls?
They need to bring their own. We have
Okay.
tubs and peanut balls, and then they can bring their own.
Okay, so that is the same as at Ascension, because birth balls, I know, like, you want to have them at a certain size that matches you. So I believe there is a birth ball policy, and you can bring your own. The next question is, can you visit and take a tour? Absolutely. There's a phone number in here, and that lovely lady there to the right, Stacy, will be walking you around. Will you be moving your office closer? No, girl, I just moved into this office, and I am never leaving this office. They're going to bury me in here. Next question, with the hospital not being as crowded for a birth via surrogate, is it more likely that the intended parents would be able to get their own room with baby separate from surrogate recovering? I mean, with the census where it is right now, very, very likely. Like, we were able to do that at Ascension, and it was at high capacity. So I feel like with the numbers that we have now and the number of rooms that are available, that would be very doable. Next question, do lactation consultants visit with every breastfeeding mom before discharge? Absolutely. And then next, thanks for your transparency. You're welcome. And then will there be any other tour opportunities? Oh, yes. When are the baby showers, the showers again? Are you doing that quarterly? When is it tentative, the next one?
Quarterly, yeah, the next date is tentative, but we should get that out here pretty soon.
Yes, we'll get
Okay.
that.
And again, so for touring the unit, we're very accommodating. You can call that number, set it up, and we'll do a private tour. So we're able to do those types of things as well.
All right, cool. How many people are allowed in the rooms during delivery? It's the same for, again, lateral move. It's the same as it was before. Doulas are not considered guests. They are part of your birthing team. Can spouses stay overnight? I didn't see anywhere for them to sleep in the pics. Yes, it's the same pull-out sofas. I don't think we had a postpartum room in the thing, but yes. Can you stay in the labor room after birth, or do you have to leave at Ascension to 2 West? So it is a labor delivery recovery, but then there are postpartum rooms currently. It's my understanding that in the works are labor delivery postpartum rooms that will be coming. I don't know when you are due, so I don't know if that will be something that's for you. But the postpartum rooms, I will say, if space was an issue before, space will be less of an issue in the postpartum rooms, and that is all I will say. How's your relationship with the anesthesia team progressing as it relates to a culture of a full circle birth? So I am excited to say that the head of anesthesia there has actually authored several papers and written many chapters and books about obstetric anesthesia specifically. She's double boarded in general anesthesia and pediatric anesthesia, and she has a passion for obstetrics, and that makes my heart sing. And so our relationship with them is fantastic. The support for the gentle cesareans thus far has been off the charts. I mean, it's just been amazing. Next statement, thank you for having this open forum. I'm so grateful for you in Full Circle. The unknown can be scary, but knowing I'm with you and your team is all I need to know. And I know exactly who this is, and I appreciate you joining me today. I know all of my mamas. This is the other thing. I can't grow too big because I know all of you, and I'm getting older. I can't remember more people. So I have to keep my numbers where I can remember people. Next question. Asking on behalf of a doula client who's unable to join, received an email. Full Circle is no longer a network with United Healthcare. Is that due to the hospital change or just with Full Circle? That's a Florida woman care issue that we hope is going to be resolved on November 1st. That has nothing to do with the hospital. The hospital is fully in network with United Healthcare. We just have some housekeeping issues we need to take care of at Florida Woman Care, which is the parent company of Full Circle. Have any of the nurses from St. Vincent Southside moved over to Memorial? If they have, they haven't told me, but I would be super excited to find out that we're going to see some of our amazing staff. But we are not recruiting anybody, just not stealing anyone. But if you do happen to come over, I'll be happy to see you. Next question, can we request a tub before arriving for labor? They'll be available for everyone. Like, you don't have to reserve them. And then what about Florida Blue Care? Blue Care, as long as it's not Blue Select, you're fine. Next question, are they baby friendly? Meaning baby can get all weight checks and care done in the room with mom. While they do not carry the baby friendly certification yet, they do behave with baby friendly principles of keeping mom with baby as much as possible. Any exams and all those things that can be done in the room. The goal is to not separate you. Next statement, not a question, but I took a breastfeeding class with Sonia last night. She was super nice and helpful. Oh, cool. I'm so glad you were able to get that information and hang with her. And I know exactly who you are as well. The next question, are tubs for birthing or just laboring? Right now, the tubs are just for laboring. We've received some interesting and exciting information about some studies that may be coming out in Green Journal regarding tub birth, but they're not available for ACOG yet. And since that is our guiding body, it's just for labor for analgesia at the moment. The next question is about analgesia as well. Will nitrous be available? Yes, it will. We asked, and HCA Florida said yes, and they have nitrous now as well as a nitrous policy. When I tell y'all, when I ask for things, like I had them by the end of the week. This hospital has been amazing. St. Vincent's pediatric providers do not have, the question was, will the St. Vincent's pediatric providers come to Memorial to see the babies? No, they will not. It will be a similar situation to most facilities in the city. They send your baby's records to your pediatrician. The next question, David, I know you looked into this. Is Mayo tier 1 or tier 2 for Memorial?
It is tier 2, but we've got some questions around that, specifically since they don't have those services. So we're working on that and to see if we can't have them move it to a tier 1.
Okay, which makes sense. It's probably just something that no one has looked into yet, but if they don't have the services, then everything else has to be tier 1, or should be rather. Next question, do less rooms mean it's possible to share rooms after? Oh, no, we do not share rooms. No, absolutely not. You have your own room all the time. Unless you're going to share that bill, you do not have to share that room. All right. Is there a NICU at Memorial? Yes, absolutely. Or would be transferred to Wilson's only in the same circumstances that that we would have to transfer from any level 2 NICU facility. Babies under 28 weeks, babies under a certain amount of grams, that sort of thing, or advanced procedure like surgical procedures. Next question, when does pre-registration need to be completed by? Here at Full Circle, we're usually giving you the information right around 28 weeks. That's always best, just so you're in the system, because again, after 28 weeks, you could deliver there. Like we wouldn't have to transfer you to a level 3 for delivery. So having your stuff on file as early as possible is always good. Next question, will HCA be providing the boy baby circumcision shortly after birth? No, we'll still be doing the Full Circle thing where we bring you back into the office, give the baby a chance to learn to be a baby, and we'll catch him here in the office before he's 10 days old. And then next question, if we need to visit emergency room during our pregnancy, is there a separate maternity emergency area? Yes, it's similar again to Ascension St. Vincent's. They have OB-ED, so there is an obstetrics ED with OB hospitalists that are on board 24 hours a day to triage anyone, and it is a separate entrance from the main emergency room. And next question, how many people in the room? Still 4, plus your donor certified doula or certified doula. Also, I heard that there's no nursery. There is a nursery, but and there's a NICU, but again, baby stays with you unless there's a problem with baby. And then how long can we stay in labor and delivery suite after birth? At St. Vincent's, I had to unexpectedly move about 45 minutes after birth to an aftercare room, and they were very small. Stacy, how long is the recovery before they go to the postpartum rooms that are not very small?
2 to 3 hours.
2 to 3 hours.
2, and then sometimes up to 3.
Okay. So it is an expected move. It's an anticipated move, and it is a move that can accommodate you and a full-size human with you and a bassinet and all the things that need to be in that room as well. What is the current COVID policy? What was the COVID policy mid-pandemic? I want to know if my husband will be able to attend if pandemic levels were increased. All of the hospitals are back off of high alert. I can just speak to that one because I know that's a citywide thing. And so the current policy is typically that you're only masking if you are currently COVID positive. There's no universal masking at this time. Next question, can moms consult with anesthesia prior to labor and delivery? We were told yes. Naisha, my OB coordinator, will be able to arrange those consultations. And Stacy, is that they just come up and they have a set time that they meet with whoever is in the box that day with their records. I know some of my moms have scoliosis or have had VP shunts or other anesthesia concerns, and they want to make sure that that they will either be able to get an epidural or be prepared for the fact that they're not going to get one. Okay, so this is that question that was before. The NICU team at Memorial was needed increased support, including NICU rehab a few years ago. What steps have they taken to take NICU care to the next level? NICU rehab. What do you know about NICU rehab, Stacy? I'll let you answer that one.
I don't know anything. Our NICU has all the support it needs, and they take excellent care. We have not had any issues.
Yeah, and I think during that time too, there's been a lot of changes to the Florida laws as far as the NICU levels.
Yeah, we're level 2. We are not going to level 3 at this time.
Okay, so hopefully that answers your question. I know at Ascension they were a 3 light at one point, and then as David said, the requirements in the state changed and they became a level 2. And that, I assume, if that's what you mean, the definitions of what the levels were changed across the state, which also changed, in Jacksonville too. And so that may have been where the support question came in. Next, how long after delivery do you typically stay in the hospital before going home? So we have, Dr. Carzoli created some policies with regard to going home. And we are in conversation with the neonatal group here now about bringing those same policies over because, again, it's the same group. Next statements are very sweet. Thank you. Love you too. And we think you're awesome too. Next questions are, we want to hear more about the relationship with anesthesia as it relates to the eating and drinking policies. They are the same as at Ascension. I met with the anesthesia group. Y'all, I've had so many meetings in the last several weeks, but I met with the anesthesia group and showed them the information that is on our website with regard to eating or drinking prior to admission. The same with eating and drinking in labor. So everything that was a policy at Ascension, again, this is a lateral move. I'm not going to move to a place that is more restrictive of birth freedoms. Next question, how long are you allowed to labor in a tub if you think you may want an epidural? Until you want the epidural. Once you get the epidural, you have to get out of the tub. So that's pretty much it. And the next question, sorry if this was previously asked, are there education courses for new moms at HCA Memorial? The answer is yes. And actually, I think if I can have my host will bring that slide, he'll add that slide into, this will be on our YouTube channel later on. And then next, also wait, I think you mean circumcisions. I won't be performing vasectomies because that means you won't be coming back anymore. But if we can connect you with the urology group that will do a vasectomy post. But circumcisions will, yes, still be performed post discharge at the Full Circle office. And next, okay, I see. Yes, a couple of comments down. She said not vasectomy, circumcisions. Maybe that's Freudian. Maybe you need to talk to your husband. I don't know. Is this the last baby for you? Great. Next, can the hospital accommodate dietary restrictions such as gluten, dairy, and eggs? And I see head nods in the back because it's a full hospital, y'all. They have all the bells and whistles. Can I still have my laptop with me just in case my husband is deployed? Absolutely. My military births where the husbands are distant are some of the most touching and heartwarming. So we would never break that up. Next question is anesthesia in-house 24/7. Absolutely. HCA Florida is a level 1 trauma center, guys. So there is not a minute of the day that there is not someone from anesthesia who is there and available. And we have dedicated OB anesthesia as well. Next question, can tubal ligation be performed here after birth? Yes, it can. How it works is we do it as an add-on case per the availability of the physician who is on call that day. The next question was, can you describe where the parking is for maternity? David, I think you can describe that better than I can because I kind of made it sound like it was a drive-by, but can you?
So we do have parking right up front. If you look at this, the picture that you have up here at the front of the hospital, there's parking right underneath that awning right over here to the right. So in an emergency, you could just drive right up. The OB ED is right there. And then we have parking along the side of that road right there, just specifically for the women's unit.
Awesome, thank you. Next question, can siblings be in the room for delivery? Siblings of the child who is being born are permitted in the room as long as there is another adult there to watch him or her, not the laboring person. And then question, if due date is after January, February 8th to be exact, Blue Select will still be pardoned. Anybody who has Blue Select at the time that we move, we are working on authorizations for you. So yes. Next statement, thanks for providing the info and being so transparent. You're very welcome. I know you are too. We just talked yesterday. Next question, in the event patient outcomes or experiences are not up to your high evidence-based standards once births are moved to HCA, is there a plan in place? So here's the thing, I am not affiliated with any facility, which is why I'm able to move right now. And as inconvenient as this is, as difficult as this is, I will do whatever is inconvenient for my practice to make sure that patient experiences are preserved, patient autonomy, patient experiences. So I don't anticipate that this is going to be a problem because, again, we've been at the same facility for 9 years, and I anticipate a long and prosperous relationship here at Florida HCA. But just know I'm not afraid to mama bear, make sure that that my patients are going someplace where they are heard and respected and safe. And the next question is a neonatologist at the hospital 24/7? And that, I believe the actual neonatologist may not physically be in the building, but the nurse practitioner, if it's like it is at Ascension, because again, it's the same group that's over there, and the staffing over there, I assume, is just by the policy of that group, that the nurse practitioner is there 24 hours a day and can begin stabilization if necessary and call in the neonatologist. Yeah, I'm getting nods. So it's the same thing. Again, lateral move, same group that's at Ascension is over here at HCA Florida. Whew, okay, that's all the questions that are there. Oh, there's another question. Will gentle cesareans be the standard, or does it need to be explicitly requested? That is a full circle standard. That was one of the first things that I asked about. And so absolutely, we've actually done a couple of them over there. And the patients have been just so thrilled with the support that they've gotten from the gentle cesareans there. And so excited to be part of this team. We're excited to have you. And best way to share birth plan with staff, just bring it in with you. Typically we have it with your chart. You bring it in after 36 weeks so that we can go over it and scan it into your chart. But you can always just bring a copy with you. And just know, like, if you guys are wondering why doulas bring patients to us, it's because we advocate for you. We ask these questions before you get to the hospital. We make sure that these things are in place before you even get there and can ask these questions. And your doula can focus on being your support person in labor. So your birth plan is absolutely welcome, but just know we've gone over it with you in the office already. We've already set expectations. So we know on both ends that you're going to be just fine. Just fine. All right, so to be respectful of everybody's time, we are pushing in on 4 o'clock. And so I appreciate all of you for taking time out of your busy day to ask me these questions and to listen to the things that I have to say about these changes that are coming up here. I want you to know that I am so excited about this, and I'm glad that this meeting is actually over too, because I've been just nervous and anxious about it all week. But I feel good about the direction in which Full Circle is going, and I thank you all so much for your trust over the years, and hope to continue to earn it every day. Take care, guys.